mode until the question and answer session of today's call. At that time, if you would like to ask a question, you may press star 1. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the meeting over to Krista. You may begin.
Hi, everybody, and welcome. Thank you so much for joining our panel event highlighting the work RPCVs at the Health Resources and Services Administration, or HRSA, do. HRSA is an agency of the U.S. Department of Health and Human Services and is the primary federal agency for improving health care to people who are geographically isolated or economically and medically vulnerable. This webinar is presented by the RPCVs at HRSA Employee Resource Group in conjunction with our Office of Human Resources as part of the coordinated efforts to hire evacuated Peace Corps volunteers and in conjunction with the current NCE opportunities. My name is Krista Mastel. I am an RPCV Mongolia 2011 to 2014. I work in HRSA's Federal Office of Rural Health Policy, and I serve as the recruitment liaison for our Employee Resource Group. In addition to recruitment activities, our group holds professional development, third goal, and social events to support RPCVs who work at our agency, nearly 100 RPCVs strong. We've included our info sheet, the Peace Corps Impact at HRSA, for you to download in the lower right pod. And now I'm thrilled to be joined by 5 RPCVs who work in different roles in different offices and bureaus at our agency, as well as a member of our Human Resources team. Each panelist will introduce themselves and talk a little about their work at HRSA. Then we'll open it up for your questions. If you'd like to ask a question, please use the raise hand feature in the upper left of your Adobe screen. You may also type it in the chat box or wait for instruction from our operator at the end of the panel discussion. With that, I'll turn it over to our first panelist, Alexa.
Hi, thank you, Krista, for that wonderful introduction. So good afternoon, everyone. My name is Alexa Ofori, and I served in Cambodia from 2013 to 2015. Here at HRSA, I also work in a Federal Office of Rural Health Policy in our community-based division, where I oversee a federal grant program that helps improve access to care in rural communities. So what really got me into HRSA and really got my foot in the door, to be really honest, was NCE. I was kind of in the middle of the job hunt. You know, it had been a few months, and I never personally saw myself in government, but I put a few feelers out there through the NCE website, and it just so happened that FORP in HRSA was the place that called me back, and once I did my initial interview, I just knew it was a really good place for me. There's just a really quick interview process, and then also, as I mentioned previously, I work in the Federal Office of Rural Health Policy, so really working to improve access to health care and rural health across America was pretty similar to what I did when I worked at a health center in a village in Cambodia. It was really to help improve that access to care. And, you know, also just my passion for public health is a very public health related position and public service as well. And so when it comes to my skills at HRSA and really how I use those, as we all know, just being really flexible and adaptable is a skill that, you know, you can take both from Peace Corps and then apply it to the government. It looks a little different, to be honest. You know, maybe you may not be riding your bicycle or walking 2 miles, but just, you know, being really patient when it comes to certain things, just being innovative when it comes to programs and working, you know, with coworkers, all those skills are very transferable. I also had some public health education experience, which really aligns really well with what I do now because the grantees that we fund through the program that I oversee, they're really just the boots on the ground, and, you know, they do a lot of what we used to do. So I really feel for them, and my Peace Corps experience is a really good way to connect to them. And as soon as I tell them what I did in Peace Corps, they're like, okay, you know what we do. So it really helps establish that relationship. And honestly, I've been at HRSA for almost 4 years now. And, you know, just my experience here continues to grow. First and foremost is a really, really strong group of Return to Peace Corps volunteers across many offices and bureaus and across many age groups. And it's just wonderful to connect to them, knowing that we all have Peace Corps in common. Also, it's a very mission-driven atmosphere, and, you know it sounds like I'm hitting all the buzzwords, but it really is, because Peace Corps volunteers, like, who else is more mission-driven than, you know, we are? And also, more recently, there is the employee resource group of our returned Peace Corps volunteers here at HRSA. And they're just a wonderful way to kind of continue, going forward with our Peace Corps experience while also wearing our hat as a federal employee. So that's it. So now I'll pass it over to Patrick to talk a little bit about his experience.
There we go. Hi, everybody. Now you can probably hear me a little bit better. So I hope everyone's doing well in the variety of ways that's important right now. My name's Patrick Johnson. I was a volunteer from 2016 until 2018 in the Hayastani Hanrepetitiun, the Republic of Armenia. Let's see here. And right now with HRSA, I am a grants management specialist. So I work in the Office of Financial Assistance Management in the Division of Grants Management Operations, because the government loves long names for things. So what does that mean? What do I do? I work on the financial side. So I don't have a public health background whatsoever at all, even a little bit. I've been to a doctor, and that's about it. So I help grantees manage their grants. So their budgets, making sure they're aligning with policy, getting their applications all spruced up and ready to go. I am the resource for health centers financially here at HRSA. So what attracted me here is that about 6 months before I closed my service, I just started applying for federal jobs with NCE like a madman. And I was applying mainly for grants management positions. I had worked with my post-small grants committee prior to, during my service, and prior to Peace Corps service, I had worked as an AmeriCorps Vista doing a lot of rural grants management stuff. So grants management seemed like something I wanted to do, and HRSA happened to be hiring for it at the time that I was looking. I'd never heard of HRSA before, which is not like the most inspirational thing to say, but like if you walk down the street and ask 20 people, have you heard of the Health Resources and Services Administration? If one of them says yes, I'd be shocked, though they probably run across our services relatively frequently, depending on where they are. So I use my skills from Peace Corps and from other experiences every single day. A lot of what I did with the Small Grants Committee when I was in the Peace Corps, and honestly a lot of my service in general, I was a community and youth development volunteer, was telling people how they basically taking skills or information from a very technical context and putting it into a context that normal people can understand. And that's what I still do with government policy about grants. So it's a lot of communication with stakeholders, which I'm sure you're all familiar with. It's a lot of analyzing your situation and responding to it appropriately. It's a lot of empathy and empathizing with people, especially in the situation we're in now, is that, these health centers that I work with are doing a lot of very important work, and being able to kind of put yourself in their shoes is important. And also occasionally navigating chaotic situations, which comes up in every workplace, and ours is certainly no exception. HRSA is really, I've found to be a great place to work. The work-life balance is incredible. As Alexa said, the people are mission-driven. People like the work that they do, and it's important work, and you can see that. And everyone's friendly. Everyone's nice. Yeah, nothing bad to say about it, really. And I look forward to answering your questions, because I'm sure there are things I didn't say and things that you want to know. So look forward to that.
All right, Sam.
Hi everyone, I'm Samantha Crawford, or Sam. I served in Niger and South Africa from 2010 to 2014. My role at HRSA, I work in the Maternal and Child Health Bureau in the Division of Maternal and Child Health Workforce Development. I am a project officer, so that means I manage funding agreements in public health and nutrition as a technical expert. I'm also the communications lead for my division, and I oversee our division's internship program, which is my favorite part. What attracted me to HRSA was, I think like Patrick mentioned, I had never heard of HRSA before, really, so I wasn't too sure about it, but I received an email seeking our PCVs with non-competitive eligibility. My background was in maternal and child health nutrition, but always on the global side, and I was happy to find out that my skills and knowledge translated to HRSA. I'm also a dietitian, and so my position isn't nutrition specific, but I made sure that I was able to work on nutrition issues from the start of getting my role, and I've been able to take on leadership roles at the bureau level and at the agency level and that as well. How I use my skills at HRSA, I use a lot of project management skills, which I think are very easily translatable and which I spruced up on a lot during Peace Corps service, so both managing short-term and long-term projects. My position was a new one, so with that came a lot of flexibility, which I feel like for my role and similar to Peace Corps service, it is what you make of it. So I volunteered for a lot of stuff when I was brought on, and I continue to do so, so I feel like I've been able to take advantage of a lot of developmental opportunities. Just some examples are like supporting HRSA's Maternal Mortality Summit, where we brought in 6 other countries for an on-site meeting to exchange best practices in addressing maternal mortality. Another one is becoming involved with the RPCD group at HRSA. I was the support liaison last year, which is sort of like our social committee, which is really fun. And HRSA is a great place to work because I think the mission is so well aligned with Peace Corps, focusing on supporting vulnerable populations who are geographically isolated, medically and economically vulnerable. There's a ton of RPCVs. Like Krista mentioned, when I was first brought on, my supervisor introduced me to a couple of other recently hired RPCVs. One of them still my best friend today. So 3 years later, it's nice to be part of such a solid community here, and there's always more RPCVs being brought on. And then the other thing is being able to have a national impact. So I think the progress can sometimes feel a bit slower when you're working at a federal level on a national scale, but I've noticed a sense among HRSA staff and Maternal and Child Health Bureau staff that there's a clear purpose to what we do, and people are really passionate about their work, and that we're really here to improve the health and well-being of America's mothers, children, and families. So I find that really inspirational. And with that, I'll turn it over to Malcolm.
Hello, everyone. Hi, my name is Malcolm Clyburn. I am a project officer and public health analyst in the Bureau of Health Workforce in the Shortage Designation Branch. What we do is we look and work with the 54 states and territories in the country on identifying health professional shortage areas, and then transition and work with our rest of our HRSA and Bureau of Health Workforce partners in identifying programs that can either help support bringing providers to those areas or offer services to be able to make the facilities in these health professional shortage areas more stable. Why I chose HRSA and why I like working at HRSA? Well, when I got out of Peace Corps, I went to one of the career fairs, and I happened to meet my hiring manager, who was herself a returned Peace Corps volunteer. And so I felt as though I was stepping into a place where my experience as a Peace Corps volunteer would not only be respected but leveraged. And I feel as though in the process of working with states on identifying these health professional shortage areas, I've been able to not only leverage my interest in public health as a community health volunteer, but also to be able to leverage the skills I learned around stakeholder engagement as a Peace Corps volunteer, and be able to take those skills and be able to foster really respectful and trusting relationships with the 6 state partners that I have. And I think that has been one of the biggest takeaways for how I've been able to translate my Peace Corps skills into the professional setting. In general, I think HRSA is a good place to work. One of the things that I was able to do with my supervisor from the day I came in, I said I want to continue learning. So like Sam, I've been able to take advantage of a lot of different training opportunities. I'm currently in a training opportunity with Sam and Krista. And I think these have been able to kind of satisfy my internal itch to always be picking up new skills and tasks. And I think that is one of the biggest benefits, one of the biggest values that HRSA is able to give to its employees is that ability to be able to learn outside of what may be your silo. Thank you.
And Rachel. Rachel, you're still on mute. Sorry, I realized that was probably on mute. So I'm Rachel. I am a public health analyst in the Federal Office of Rural Health Policy, so I work with Krista and Alexa. I served in Zambia from 2014 to 2016, and I also currently serve on the RPCVs at HRSA Employee Resource Group as the co-president along with Alexa. So the reason I chose HRSA is it's an organization I was interested in even during grad school while I was studying for my MPH, and it really is like about the mission, the work that HRSA does, working with underserved communities and really reaching some of the hardest to reach populations and giving them services and programs that are critical. It's really what drew me in, and it's what keeps me going every day. One of the ways I really use my Peace Corps skills is that, you know, working with like underserved communities, it's something that, I mean, as a Peace Corps volunteer, that's what you're doing. And so I really come in with that cultural sensitivity. I feel like a lot of that comes into play, particularly working with rural communities. There's a lot of different cultural elements that come in with the work that we do. The other thing I really love about HRSA, like Malcolm was talking about, is the constant learning and training opportunities that HRSA offers. HRSA is really big on developing their workforce, building the skills of their employees, and so there's just so many opportunities out there for you to gain more training both in your job and as well as in your personal growth as a leader. And that's something that's just really stood out to me about HRSA from when I started interviewing, and it still rings true today, and it's something I really love. And then the other reason I think HRSA is a great place to work, like everybody else has mentioned, the Peace Corps community here at HRSA is strong. There's a lot of camaraderie with each other, but it's also something that's really respected and valued with HRSA leadership, from our managers all the way up to the highest leadership within HRSA. They really value the skills that our PCVs bring to the agency, and they know that the skills that we bring are a match to the work that we're doing every day. And so it's nice to be part of a community that really supports and appreciates that. And that's all I have. Thanks. And up next from HR, Chris.
Thank you, Krista. Thank you, Rachel. Good afternoon, everyone. I'm Chris Parker. I'm the Talent Acquisition Strategy Manager within the HRSA Office of Human Resources. I've been at HRSA almost 8 years, and I've spent my entire federal career actually within the Department of Health and Human Services. Like my colleagues were mentioning earlier, the mission of HHS initially drew me in, and I've spent an entire career here, and I've loved every minute of it. I'm here today to talk to you a little bit about how RPCVs add so much value to the HRSA workforce. Their level of resourcefulness, being able to hit the ground running, their experience with community-based programs, project management background, it's all a major asset to the HRSA bureaus and offices. Also, having someone that knows how to be resourceful, work with limited guidance, limited structure, limited resources, all of that is key to being successful in the HRSA workforce environment. We currently have 4 announcements posted on the Peace Corps website. 2 are management analyst announcements. They are at the GS9 and GS11 levels. We also have 2 public health analyst announcements. They are also being advertised at the GS9, GS11 levels. All of the announcements close on Monday, April 13th. So if you haven't seen the announcements and you haven't applied yet, please, 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 I implore you, please go take a look at our announcements when you have an opportunity. The major duties of each of the positions being advertised are outlined within the announcements, along with the application instructions, the salary information, the qualification information. All of that information is laid out for you within the body of the announcement. So please, 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 if you have an opportunity, please apply. If you have any questions regarding any of the announcements, I have an email address for you. It's rpcv@hrsa.gov. You can send questions regarding announcements directly to that email box, and someone will get back to you within 24 hours. Thank you all for the opportunity to speak with you today. I really appreciate it.
Awesome. Thank you, everybody. We have a couple questions that came into the chat, so I think we will go to those first while the operator opens the queue for the rest of the questions. So I will pose the first question to the group if maybe 1 or 2 of you with different roles would like to answer. What's a day in the life look like at HRSA?
Hey, this is Patrick. So a day in the life for me, generally, so it depends on the time of year. Well, my camera's not working. Well, it depends on the time of year. My work is very seasonal, so it follows the application deadlines. So like there is a time of year when I'm reviewing applications and making sure all the budgets are correct and getting in touch with health centers, finance people about if there's an issue. There are different times of year when financial reports are due, and I'll be reviewing financial reports and having that same communication. Right now, it's been a lot of answering questions. HRSA has recently put out $1.4 billion for health centers to respond to COVID-19. So a lot of what I'm doing recently is canvassing or fielding questions from grantees about how they can spend their money and how they need to budget things and just technical things like that. It can be pretty varied depending on who decides to pick up the phone on a given day.
Yeah, and just to add to that, sorry, go ahead, Sam.
No, you go, Malcolm. Sorry.
I was going to say that, one of the interesting things, especially in this current time, that is, I think, been a good thing with my usual day at HRSA is that we've had a little bit of practice with the remote work style. Most people, or a lot of people at HRSA telework, if not regularly, but ad hoc. And so that has been a good transition into our current work style. Similar to Patrick, depending on the part of the year, my day in the life is very different. One good constant is that I kind of have a core team of people that I'm constantly working with. So throughout that time of year, all of us are shifting to different priorities. And so it works good because you have other people to kind of touch points on and keep you in like a timely and productive fashion.
I'll add on that. I feel like my level of work depends on a weekly basis. Like Malcolm mentioned, it's pretty common for people to be teleworking. I'll say there's a lot of variation across HRSA, what that looks like. But for me, I usually telework on Mondays in a more typical situation. And then I work longer days, so typically like 7:30 to 5. And then I have every other Friday off, and I get off a little earlier when I do work on a Friday, which is nice. So typically when we're all in the office on Wednesdays in my division, I'm in meetings all day, and Tuesday and Thursday tend to be pretty heavy with meetings for me as well. Mondays and Fridays are generally a little lighter, so I'm able to catch up on personal projects and other things.
All right, I'm going to throw this next question to Chris. It's advice to maybe folks with limited experience and leveraging their NCE effectively. Does HRSA ever hire people with sort of introductory level experience or senior advanced levels of experience?
Yeah, actually there will be a multitude of hiring managers looking at all of the resumes once the announcement closes. So, and they're looking to fill a variety of positions. HRSA has an abundance of professional positions and also administrative positions at the professional and entry-level positions. So, yeah, if you're just looking for an entry-level position, still please apply. Please submit your resume. Do your best to really expand on any experience that you've had. I think for the one specifically for the management analyst announcement, if you have any programmatic experience, any administrative experience, you know, go ahead and highlight that within your resume because we do have hiring managers that are looking for people with those skill sets.
And another one for you, Chris, about how often do positions come up and how long does the process take sometimes?
For these specific positions, they're going to be moving pretty quickly, I can say that. We're hoping to have resumes in front of hiring managers within the next 2 weeks after the announcement closes, if not sooner. So these will move pretty quickly due to the demands of our hiring managers and also due to the current pandemic. So that was, I'm sorry, I didn't catch the second part of the question, Krista.
It was how long the process usually takes. I think you got that in there.
Oh, okay. Yeah, and normally I'm going to brag about my colleagues for a second. Our HR office generally turns things around pretty quickly. Normally, I'd say the process takes about a month. In the current, a month or less, but in the current, with the current circumstances, you can expect the turnaround time to be 1 to 2 weeks. We'll have resumes in front of hiring managers at HRSA.
Awesome. So this one I'll pitch to the entire panel if anyone wants to chime in about opportunities for social work or human services. So maybe you can speak to skills that you had outside of public health or program management for those of you that maybe don't have an MPH. Maybe you've got some MSWs or MAs or other project management. So folks who have other degrees or skill sets, how are those leveraged at HRSA?
So I have an MPH, but I could speak to like colleagues that I know. We have several colleagues who work with us in the Federal Office of Rural Health Policy, and I know throughout HRSA that have degrees in social work. So I think the interesting thing about HRSA is that the work we do touches a lot of different levels, so it's not all just straightforward public health. There's a lot of different programming that we do. So I know we have programs in some of our bureaus that are focused directly towards social work related things. We have programming like in the Maternal Child Health Bureau that's focused on different elements besides public health.
even in the Federal Office of Rural Health Policy, a lot of what we do is not just public health. So I think if your background is in social work and that's where most of your experience is, bring it to HRSA. I think the work we do is unique in that it touches so many different areas because our programming is really broad. So I would say that it's definitely a benefit.
And Rachel, maybe if you could continue that thought and just talk a little bit more about broad skills and maybe things that, you know, are outside of Peace Corps or your education that you find valuable too, and you can address the next question.
Yeah, so some of the broader skills I think that are really helpful, you know, in work that I've done before even jumping into public health, I did a lot of like data analysis work, working with like, even just understanding like how data is tracked and monitored and things like that are useful. I'm thinking of like communication skills. So this is one example of how we're constantly communicating, but HRSA does a lot of forward public-facing work. So being able to speak to diverse groups, big audiences, things like that are also some skills that I've found really helpful. I'm trying to think if there's any other really broad things that come to the top of my mind. I mean, communication is big. Writing skills have been really helpful. I spend a lot of my time writing reports and funding opportunity announcements and different things like that. So you're utilizing those writing skills that no matter what your background is, you've gained those during your education experience.
So there's a question about employee benefits. The answers are yes, yes, and yes. But maybe Chris, if you'd like to talk a little bit more about some of those flexibilities that HRSA has implemented to keep employees safe during COVID-19.
Yeah, I mean, currently I can speak, I guess, from the HR perspective, the majority of the HRSA workforce is teleworking right now. So my supervisor was in the office the other day, and she said she saw 3 people in our entire building. Our building holds 3 or 4 agencies, federal agencies, and we have close to 5,000 to 6,000 people in our building. So I think with the current pandemic, hiring managers are being really, really flexible with employees, you know, in terms of work-life balance, kind of managing that, telework expectations. Yeah, there's a lot of flexibility. And I'd like to say I've worked at a couple of different federal agencies, and even before the pandemic, HRSA is known as one of the more flexible workplaces within the Department of Health and Human Services. Our hiring managers are great. They're so mission-driven, as my colleagues have said, and you know, the majority of the staff is as well. So you know, hiring flexibilities, you know, they're not frowned upon.
And another one for you, Chris. We had 2 questions that came in about the location. So if you maybe talk to whether they are at our offices here in Rockville or if they are also throughout at our regional offices.
Yeah, the location for the current positions are at headquarters here in Rockville. And again, the hiring managers are looking for a multitude of positions. We had a meeting today with the executive officers of all of our bureaus and offices, and we told them about this webinar that was going on this afternoon, and we also told them about, hopefully we'll have an abundance of applications to share with them in the next couple of weeks. But yeah, the majority of the positions are located in Rockville, Maryland at our headquarters location.
And just piggybacking off that, could you address if those positions will be temporary or permanent?
I have to take a look at the announcements again. I believe the majority of the positions are going to be permanent. I saw one of the questions in the chat. Do the announcements require NCE documentation? Yes, they do. So if you have that, please submit it. I know some of you are just getting back and you don't have it. That's okay. Please still submit your resume and just indicate that when you apply. Just say that you're waiting on your NCE documentation. And we'll take that into consideration as well in light of the current circumstances.
Awesome. So you can keep typing in the chat if you would like. I see a few people are doing that. At this time, though, I will ask Valerie, our operator, if you could please give instruction and open the line for questions. We will see if we have any that are waiting on audio. So Valerie, could you give instruction for that?
Yes, if you would like to ask a question, please press star 1 and record your name clearly. To withdraw your question, you may press star 2. One moment, please, for our first question.
And then while we're waiting for audio questions, Chris, could you maybe clarify, will hiring managers be looking at resumes as they come in or as positions close? And I would say for both the USA jobs and the career link positions, if you know.
We'll be submitting all the applications after the positions close, and we'll be submitting them in batch format. So, yeah, we'll turn them around pretty quickly. Like I said, there will be a couple of us working on these particular announcements to turn them around pretty quickly. So, yeah. So basically, I'm thinking the week of, I don't have a calendar in front of me. I think it's April 21st. Is that a Monday? Does anyone know? I think the week of April 21st, we're looking to have applications in front of managers that week.
And then maybe for Chris and for the rest of the panel, any tips on the resumes, preferences around federal or just a 1 or 2 pager, any skills that, you know, maybe they should think about highlighting from both your experience working in the bureaus and offices, maybe also from the HR perspective, any tips on that?
I'll go ahead. This is Chris. I'll go ahead and I'll start. I can tell you from the HR perspective, it's all about content. It's not about the length of your resume. Just ensure that you're speaking directly to the knowledge, skills, and abilities that are required for that particular position. So that's what the hiring managers are looking for. From an HR perspective, that's what we're looking for. We're not really looking for, I can tell you, when I'm looking at applications, I'm not looking for buzzwords or anything else. I'm looking to see if you've truly done the work and you have an adequate background to perform the duties of the position. You know, is that background a mix of education and experience? If so, then definitely highlight that. You know, I think a lot of times applicants sell themselves short. So again, I'm not looking to read the abbreviated version of War and Peace as an HR manager. So, but at the same time, the content is more important than the length.
All right, Valerie, were there any questions on the phone line?
We do have one question in the queue. The caller did not record their name, but go ahead, caller. Your line is open.
Hi, I'm so sorry. I thought I recorded my name. I had actually typed in the question as well about NC documentation and just making sure that for that we just need our description of service. Is that correct?
Yes, that's correct.
Thank you.
Sure.
And Rita, I see that you raised your hand. If you have a question, feel free to type it in the chat, or you can follow the operator's instructions to ask it audibly.
Chris, I have a question.
From the HR perspective, what are your thoughts on people submitting a cover letter?
I can tell you from my perspective, I prefer a cover letter. I get additional information from the cover letter, and I'd like to think that the hiring managers do as well. I can tell you, I've gone through and looked at the applications that we've received so far for the positions that we've advertised, the management analyst and public health analyst, and I'd say probably 75% of the people have submitted a cover letter. Again, it's just a preference. It's up to you. If you decide not to submit one, or if you submitted your application forward and you didn't have a cover letter, it's okay. Yeah, but from an HR perspective, do we take a look at the cover letter if you have additional information in there and add that, do we count that in terms of the content? Yeah, we do. It's part of your application package.
I'm going to shift gears and ask a little bit about the work again. So panelists, if anybody wants to talk about or address, are there field work opportunities?
I feel like I've been talking a lot, so someone feel free to interrupt me.
Okay.
So most of the work for me, it kind of depends on your position, is based at headquarters in Rockville. For me, I go on site visits pretty regularly and or conferences. There's a lot of opportunities for those. So on average, I would say I travel once. In typical conditions, I travel once a month or once every other month, but I would say that might be on the higher end compared to some of my colleagues, especially if they have young children or things like that. There's flexibility built in to make sure that the work gets covered.
Mm-hmm. Yeah, and to add to what Sam mentioned, in FORP we've had some opportunities to travel as well in my experience, also with site visits and conferences, but also just gatherings of partners. Whether these are federal partners or state partners, we have opportunities to travel in that way. And I think we've also had some opportunities to travel for some grant workshops too. We've done some grant writing workshops for folks in many different rural communities across the country. So those are always like a little fun, and it mixes things up a little bit.
And while we're talking about our work, we have a question about skills and experiences from Peace Corps that would translate to either the public health analyst or the management analyst role. So maybe if two or so of you want to speak to specific experiences you had in service, I'll turn it back to the panel.
So during my service, a lot of my time was spent between working in a community health center in Mozambique and managing a group of about 18 community health workers. The experience of not only working with the community health workers, but doing that like scheduling technical assistance for them and identifying good training opportunities for them to be able to broaden their skill base and to transfer that knowledge has been very helpful at HRSA. Because a lot of the job of a management analyst who's a project officer is identifying what technical assistance is best, or listening appropriately to your grantees and recipients to identify what training they'd be interested in, what information that you have will be helpful for them in doing their job, and also making sure that they have some of the resources that you have available are shared with them. So that work of working with people and being able to kind of have a question asked to you, answer the question as it's asked, but also try to delve a little bit into what's not being asked has been super helpful in my position as a project officer for sure.
All right. Two questions probably back for Chris. So do they need to also include references? And does HRSA honor or accept NCE for folks that get master's degrees? Will they honor and accept them?
To answer the first question regarding the references, no, with your initial application. If you are interviewed by a hiring manager, then when you go for the interview, they might ask you for references during that time. But in terms of submission with your application, no, we don't need to see them right up front. And the second question, I'm sorry, Krista.
The NCE extension. So if someone goes to grad school, they can delay their NCE for up to 3 years. Will HRSA honor that?
Correct. Yes. Yes, we will. Thank you.
And also, Chris, do we have any opportunities for internships for people who are maybe here to Rockville? Anything through pathways or opportunities that way that you know of?
Yeah, actually we do. We did have a Pathways announcement for summer positions. It's weird, we open those announcements up usually in February. You would think we'd open them up later in the spring, and we still get over 1,000 applications generally for those announcements. But we're always looking to fill recent graduate positions. I don't believe we currently have anything advertised, but it doesn't mean that we won't have opportunities that will come up, especially here within the next month or two. I think the managers right now are trying to figure out with this new working environment that we're in, this new virtual environment, they're trying to figure out how to manage virtual interviews and things of that sort. So if you don't see anything posted, it doesn't mean that there's not opportunities there. I think just right now, managers are just trying to figure out the virtual environment.
Yeah, makes sense. And then there was a question about who you talk to delay NC. There's no one to talk to. You just need to note the dates and then the reason why will be something like grad school. So you make the dates that you got it and then the amount you have left abundantly clear on your resume. I'm going to kick it back to the phone line. Valerie, do we have any other questions in the queue?
We have no further questions in queue.
Okay. I see we have just about 5 minutes left. If there are any other questions, please get them in the chat or into the phone queue. We'll pause for just a moment to get in your last questions. While we're waiting, our PCV panel, is there anything else you'd like to mention or anything else that was sparked from any of these discussions?
Hey, so I just typed it in the chat box, but another skill that I was thinking of that a colleague who is on this webinar reminded me of is partnership development. I think you do a lot of that in your Peace Corps service. You've probably done a lot of that even prior to joining Peace Corps. Definitely highlight that. I think as a project officer, a public health analyst, even in the management analyst role, partnerships and relationship building are huge and a big part of the work we do at HRSA. So highlight that.
All right, we got a question in the chat. I'm not sure anyone will have a concrete answer, but maybe for Chris and for the panel, what's the likelihood to get a federal job with shorter Peace Corps service, but also AmeriCorps and a master's degree? So maybe different levels of qualifications.
Well, I was an AmeriCorps volunteer prior to being a Peace Corps volunteer because I just hate making money. That was actually a source of a lot of my experience was from AmeriCorps. So as long as you can connect that to your job, and AmeriCorps, there are a million different kinds of AmeriCorps positions, but as long as you can bring that in and connect that service to the job that you're applying to, it's absolutely useful. And even if your Peace Corps service was shorter, you still did things, you still had experiences. I'm sure that there's something in there that you can, bring in. Even if it's even if it's shorter than you expected, there's still experience there that you can bring. And a master's degree, a master's degree is great. It qualifies you for a lot of more stuff just on the basis of education. So I'd say, it's always worthwhile to ask the question of the hiring manager. The worst thing they can say is no.
Chris, anything you wanted to add to that question?
No, Patrick actually hit the nail on the head. Yeah, there's definitely, I was just going to say honestly to the whole group, please, 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 I implore you once again to apply to these jobs. I can guarantee you if you submit all the required documentation, your application will be in front of a hiring manager in the next 2 weeks. So at least it will be seen. I can tell you there's definitely an interest in getting all of these positions filled pretty quickly. So once again, I believe Chris has sent the link to the one of the vacancy announcements out in the chat, and if you use the search function on the Peace Corps website in terms of vacancies, if you just type HRSA in, all 4 announcements will pop up. So.
All right, I think we have time for one last question. I will check with Valerie again. Anything else on the line?
No questions in queue.
Okay, and I see we have one person typing, so we will hold for that. All right, so maybe for Chris, a draft version of the DOS if they don't have the final signed version from their country director yet. Is that acceptable?
Yep, that's acceptable. Especially in these current circumstances, that's acceptable.
Well, with that, I will say that our time is up. I want to thank all of our panelists for their time and conversations today. Thank you to everybody for tuning in. Please be sure to apply to those open NCE positions on the career link by Monday, April 13th. You're also welcome to reach out to myself, the recruitment liaison, with any questions by emailing RPCVs, plural, at HRSA.gov. Or you could reach out to Chris at HR, emailing RPCV, singular, at HRSA.gov. But thank you again for your time this afternoon. We appreciate it, and enjoy the rest of your day.
This now concludes today's call. All participants may disconnect at this time.